So you basically went to my supervisor, lied about me, tried to get me in trouble instead of verifying with me if I did what I was supposed to be doing, which I did. And your husband gagged you, bitch. And I remember her just like going off on one of the male nurses, and she looked at him and she was like,
"You are so ugly. You are so ugly. You look so dumb too with that bald head. You're so ugly and dumb looking."
Something about me triggered him, okay? I don't know if he dated like an Asian guy and like he, you know, got his heart ripped open. This person looks possessed. Like, help me. Hey guys, this is George, your favorite registered nurse, travel trotter, fashion fiend, and foodie. And today we are going to talk about some of the worst patients I've had to care for, okay? I know there are worse, and I'm sure there are worse for the span of 10 years I've been a nurse, but these are the ones that just like came into my head when I was like, let's make a video about the worst patients I've taken care of. So if you're new here, don't forget to like, comment, subscribe. On my channel, we talk about nursing, fashion, travel, and food, okay? So let's get into it. I'm not gonna hold you back any longer. If you wanna be a nurse, you probably shouldn't watch this, but if you're on the fence, you should probably watch this because this is the reality. You're gonna take care of really awful patients, really awful patients, really awful patients.
I'll put soap in your mouth.
Fuck you.
Like your mother should have.
Yeah, she did, and I ate it, and I loved it too, bitch.
She's spicy, dude.
But then there's gonna be a lot of patients who are so nice to you, so thankful, so grateful, so grateful, so grateful.
Lies need to stop, cause I'm icy, wifey. Haters wanna fight me, wifey. Haters wanna fight.
And you're gonna be like, this is why I'm a nurse. All right, let's get into it. Sorry about the noise. They're doing like lawn care. When I'm doing my video, like, oh, I can't believe it. It's like when someone's talking during your interview, okay?
Oh, coughing during my interview, really? Shoot him.
Anyway, you know, sometimes there are some patients who will never leave your unit. They will make any excuse just to stay a couple more days on your unit. They'll pull anything and everything just to stay in the hospital. We nurses, we call them frequent flyers, okay? So this frequent flyer, let's call her Motorized Martha. So Motorized Martha had a motorized wheelchair that she would get in and out of whenever she pleased. She treated she treated our hospital, our unit, like it was her own personal playground, okay? She was very entitled, very rude, and just like, ugh. Okay, she's one of those people where the nurses would like come in the morning, look at their assignment, and in their head be like, oh God, I hope I don't have Motorized Martha. I hope I don't have Motorized Martha. I hope I don't have Motorized Martha. And I was one of them. Because she was awful. Anyway, the units I've worked on, you're supposed to be there for 14 days. 14 days max, okay? You're not supposed to be there for any longer than that, okay? This woman, she stayed on our unit for like 5 months, okay? Before I got hired, she was already been there for months, and I just can't believe like our healthcare system allows this. She like knew how to work the system though, so she was a hoarder because every time I would open that door, it was dark, no lights on, shades was down, but there was a ton of crap everywhere. It was like she was living in a storage unit, okay? And I don't know, but like me and my coworkers would talk and be like, did you see something crawl on the floor? We swear there was either rats in there or roaches, I don't know, or both, but like I just remember things scurrying down the floor, but it was dark in there because she never had the lights on, so can't confirm that. It's a blind item like Dumois. But anyway, the one thing people liked about taking care of her was that she would just ignore you. So when we did shift report, we would open the door and be like, hey, Motorized Martha, I'm George. I'll be your nurse today. Totally ignored me. Didn't look at me. Nothing. Hey, Motorized Martha, I have your 9 o'clock medications. Would you like to take them? Totally ignored me, which is fine because then I'm going to put Patient refused 9 o'clock meds. Will continue plan of care.
Patient refused medication at 1800. Patient stated, I'm not taking that nasty ass shit. Explain to patient the importance of the medication. Patient stated, shut the F up, you fat heifer.
So it's kind of like basically having, and if I had an assignment of 6 patients, I basically had 5 because she would just ignore me all day. I would still do my hourly rounding, honey, because like, I'm still gonna give you 100% as a nurse, whether you like it or not, bitch. She was just like one of those people who was very rude. And I remember that like she would come out of her room as she pleased on her motorized scooter. And I remember her just like going off on one of the male nurses, and she looked at him and she was like,
You are so ugly. You are so ugly. You look so dumb too with that bald head. You're so ugly and dumb looking.
and I'm like, this was like one of my earlier jobs. So I was like, what did I sign up for? Like, I didn't get signed up to be a nurse to get berated by a patient. Like, she never said anything to me because obviously whenever I'm in my figs, I'm just giving you Bella Hadid, you know? So no one's gonna come for me, bitch, okay? But anyway, some of the other nurses, like, she would just say nasty things to them. And I was like, girl, you can't be talking like that because, honey, you're not doing anything. You shouldn't be talking about other people and what they look like. Okay, so motorized Martha definitely had some psych issues, but like she was still alert and oriented, like knew her name, knew where she was, knew the date, etc. This person was none of the above, honey. He was fully confused, fully crazy, fully psychologically and mentally not there. What made it worse was that he didn't speak a lick of English, honey, okay? Perfect recipe for disaster, and he was my patient. So let's call him disturbed dialysis disaster Diego. Okay, so Diego had dialysis 3 times a week, which is the normal schedule for someone who has hemodialysis. So if you're not a nurse, hemodialysis is basically when your kidneys, which is a filtration system in your body, they're not working right. So you need like some kind of like surgery to get a fistula on your arm, which is basically a huge looking like vein/artery on your arm to filter the excess water, excess solutes, the toxins, and you need that filtration for him to live, basically. So he had a fistula because he was getting hemodialysis. A fistula is basically a man-made surgical intervention where the native artery and the vein are connected. And usually it's on like the upper arm. So he had it, I think, like right here from what I remember. So basically he's connected to a dialysis machine with 2 large needles. One of the needles removes the blood and sends it to the machine where it becomes cleansed. And the second needle allows the clean blood to go back to the body. So basically, disturbed dialysis Diego disaster was crazy. He was crazy. It just is what it is. You're gonna encounter patients who aren't fully there, you know what I mean? So, but I was on a rehab unit at this point, so I was like, why is he here? He's not really, like, this isn't working. Like, he's not supposed to be here. He should be on a closed psych unit, okay? Like NSYNC, and he needs to be in a straitjacket, like NSYNC, okay? So Diego was crazy, clinical dementia, confusion, etc. He did not like me. Something about me triggered him, okay? I don't know if he dated like an Asian guy and like he, you know, got his heart ripped open, or maybe I don't know. I triggered something in him. He didn't like me, okay? Because the first time I met him, 9 o'clock meds, I scanned his bracelet. He like got up from his chair. It looks like he was gonna start dodging at me, but like I calmed him down. Crisis averted. That was weird and scary. So I came back second time, okay? So I came back a second time at noon to give him, I think I had to check his blood sugar or something. So I scanned his bracelet. This time he got up and was like coming at me this time, okay? And so he cornered me in his room, and these patient rooms in this hospital where I worked at were private rooms. So there wasn't a patient there who I could be like, hey, can you like call for help? Like put your call light on. So I was cornered, but like I was very smart and I took the call bell and I pulled it out of the socket. So obviously the bells would ring and the freaking like light outside of his door would like start flashing. Like that means like someone needs to go into this room. So thank God the respiratory therapist came in and she like calmed him down, but he like still followed me. He followed me into the freaking hallway and I noticed like a lot of blood everywhere and it was like scary. And where was he bleeding from? His dialysis fistula. So there was blood everywhere and I have this patient coming at me looking crazy and I thought he was gonna hurt me, but like thank God like the other nurses and one of the doctors calmed him down. So anyway, long story short, we had to ship him off to ICU because it's like we need to put pressure on his fistula because it's a highly vascular area and it could just like bleed out. He could hemorrhage, he can die. And so we shipped him off to ICU. And thank God, because I never want to deal with him ever again. No offense, but he looked very crazy to me. His teeth were like, I don't know if he's ever been to a dentist or he used to eat stones and rocks for lunch. I don't know, but he looked crazy with his teeth. His eyes looked demonic. He had glasses on, but he was like, his eyes were like cross-eyed, so like that scared me too. And then he like was walking like a monster. Like he had like this I don't know. It was crazy. Like he looked crazy to me. I'm not trying to throw shade. I'm just like giving you what I saw. So you have someone looking like that coming at you, speaking in a different language, and you're like, this person looks possessed, like, help me. This person looks possessed, like, help me. This person looks possessed, like, help me. So I was very happy to get away from that patient. Okay, this next lady, she was just very entitled, very disgusting, and like I just like, you know, you have those people who like don't know how to like chew their food without closing their mouth. That's how she was, but not only when she was eating, but like 24/7. So let's call her mouth smacking Marguerite, okay? Mouth smacking Marguerite was this older lady who was always smacking her mouth like that, okay? And it was so gross. I'm like, girl, are you a cow? Because like, do you need a cowbell? You're acting like a cow. Do you want me to put a cowbell on you? So gross. It's like one of my icks because I have a family member who eats with their mouth open and it's just so gross. Pair that with someone who's very rude and disgusting. This is mouth smacking Marguerite, okay? She was very much addicted to her pain medicine, okay? She was one of those people who, even though the medication is PRN as needed, she wanted it every 4 hours. She would put her call bell on asking for her pain meds when it's like, are you really in pain? Mouth smacking Marguerite, like, what's your pain level? 10 out of 10. Saying you're at a 10 out of 10 for pain, but you're watching Family Feud and you're watching, you know, Who Wants to Be a Millionaire and you're laughing and you're giggling and you're like having a grand old time and you're playing Bejeweled on your cell phone, but you're at a 10 out of 10 for pain. That doesn't make sense to me. She was always saying things like, oh my God, George, you're drinking Starbucks again. You're drinking Starbucks again. Coffee's so bad for you. Coffee's bad for you. I'm like, girl, like...
Sorry, I'm late. The line at Starbucks was so long.
I just remembered this one time, one of the patient's families came in and gave us like a nice box of Dunkin' Donuts, just like very nice. And on the box, it says, to all the nurses, thank you for all you do. Here comes mouth smacking Marguerite. She sees the donuts, reads the message, to all the nurses, thank you for all you do. Opens it with her sticky, disgusting fingers, takes one and eats it in front of us. I'm like, girl, like, I know you can read. Okay, guys. Like we just talked about, frequent flyers. This was a frequent flyer patient, but it was like a dynamic duo with her and her daughter, her psycho daughter. So this next lady, let's call her Blacklisted Betty. So Blacklisted Betty had a flesh-eating bacteria that smelled like dead meat on her legs. okay? Ugh, literally, I can't. Literally, I can't.
Literally, ew, I can't. Ew, literally, ew, I can't. Ew, literally, ew, I can't. Ew,
The smell of it, whew, it smelled like something I've never, like, smelled before. And I'm very, like, with smells and everything, like, I don't throw up, but I know a bad smell when I smell it, okay? And I remember doing her wound care on her legs on Blacklisted Betty's disgusting flesh-eating legs, bacteria on her legs. I had to do the wound care. And how the wound care was, I needed someone to like lift it up so I can wrap it after the treatment was done. So I asked one of my coworkers and she came in, we did the wound care, but I could see in her face that she was so in distress, my coworker. We leave the room after the wound care. My coworker takes off her mask and she looks at me and she's like, George, like, I love you, but don't ever ask me to help you again with this person because I almost threw up. She literally almost threw up in there and I felt so bad because she was just doing me a favor. So that's how disgusting her legs were. Anyway, this woman only wants to do the wound care when her daughter's in there. And her daughter was one of those people who was very like entitled as well, and she didn't really help either. And every time we would do her wound care on her legs, the daughter would be like making faces and like wanting to die in there. I'm like, honey, like, you're not gonna get an award for just sitting there. Like, why don't you help us? You know what I mean? I hate when family members like don't want to help their family. I'm like, your family isn't gonna go to a nursing home. They're going home with you. So like, don't you think you should start trying to learn how to help your family now? Like, because it's just gonna be you and your family member at home. I don't know why people don't like understand that. The daughter would come in around shift change, and that's when she wanted us to do the wound care, which is just like so inconsiderate because at 6:50, I want to have my meds all done. I want to have my charting done. I want to have my wound care done in order to be ready for the next shift, okay? Because that's inconsiderate. Like, I don't want to be waiting for a report. So why I don't want my coworker to have to do that, you know?
Thank God you're here. Where have you been, bitch? Where have you bloody been? What time is it?
But like this lady with her flesh-eating bacteria on her legs, Blacklisted Betty, wanted her daughter to be there after work whenever we did the treatment. And I'm like, why? Like, she's not doing anything anyway, you know what I mean? And I'm like, another thing with this lady, Blacklisted Betty, was that everything was like so dramatic. Every single time we would like touch her or turn her or whatever, she would scream bloody murder. She would just be screaming. And I'm like, girl, like, is it really that painful? If it is that painful, it's because you did that, okay? She was one of those people who, when she would like have an incontinent episode, like if she pooped or peed on herself, she wouldn't want anyone to change her. And I'm like, girl, like, we need to change you. Like, this is getting worse, and like this bacteria is getting worse because the feces and the urine is going onto your legs. Like, let's help you. She would rather sit in it. And we would call the daughter and be like, hey, like, blah, 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 blah. And like her daughter would be like, yeah, that's how my mom is. You're joking, right? Like, you're actually joking. Like, you're not even gonna try to convince your mom to like maybe get changed. I don't understand that. The next patient was really nice, okay? You're gonna get some nice patients. His daughter and his son-in-law, so nice. I'll never forget this guy and the family. They were so nice to me. Hey, George, like, thank you so much for all the care you give to my dad. Hey, George, like, how's your night going? Like, it's nice to see you again. Hey, George, like, thank you for, like, all the care you give to my dad. Like, he really appreciates it. You're gonna get those amazing patients and amazing families. But you will also get one of those family members who doesn't show up and thinks they know everything and is in the medical field. So I noticed this one night, I had this patient, the family comes in, the daughter and the son-in-law, and then this younger girl comes in. I didn't know who she was anyway. So this patient was diabetic, so I checked his blood sugar before the family got there. And while they were there, I gave the insulin. this young girl who looks younger than me was like,
What are you giving him?
and I was like, let's call him Alan. I'm giving your family member Alan his insulin. She was like,
Well, are you not gonna check the blood sugar?
oh, I actually did check the blood sugar before you got here. It was like 222.
Okay, so, well, how many units are you giving him? Is that long-acting insulin or is it fast-acting insulin?
Girl, who the fuck are you?
Bitch. Oh, no, you didn't. Were you trying to call me out?
Who the hell are you? I don't even know you.
Was ist mit J-Lo? Die kenne ich nicht.
Okay, so why are you talking to me like that? I gave her all the answers. This girl, she goes to the bathroom. The daughter of the patient, clearly embarrassed. She says, oh, that's our niece. She's in nursing school. I knew it. I knew it. It had to be someone who is in nursing school or is a nurse or something in the medical field. It's just when like your nurse manager comes around and gives you your assignment or you see your assignment and they're like, oh, you have room 100. They're a VIP. Oh, room 104, the daughter's a nurse practitioner. As a nurse who's been a nurse for like 10 years, I'm here to tell you, no one cares.
I'm here to tell you right now, we don't care. Let me tell you, we don't care.
No one cares if your family member is like a VIP or is a doctor, nurse, whatever. No one cares. Okay, because it's like, I'm gonna treat everyone how I treat everyone, which is equally. I don't care if your son is the CEO of the hospital I'm working at and you're the mom and you're my patient. I don't care. I'm gonna treat you equally as good as everyone else. And I'm gonna give it to you 100% great nursing care. So don't expect me to like go above and beyond just for you, because I'm gonna go above and beyond for all my patients. I don't care if you're a VIP. Like, get it together, girl. Like, why don't you pass your NCLEX before talking to me like that? Sticking to this theme of like the family being in healthcare, I had this patient. This patient was really nice. See, again, it's like most of the time the patient's nice. It's just like the family member's too much. So this patient had a Foley. So that just basically is like a tube connected to your bladder, and it drains the urine because you're not able to drain the urine yet. Maybe you had an acute kidney injury or you just came back from surgery and you haven't got the feeling of urinating yet. So this patient had a Foley. So his wife was a nurse, or at least that's what she said. This bitch like was a liar, okay? Let's call this family member Lying Leandra. So Lying Leandra told my supervisor that like I don't remember if like I didn't give a medication or I didn't like do the Foley care or something like that. So one night I like had this patient and like my nurse supervisor pulled me aside and she was like, hey, like, you know, this patient that you're taking care of, the wife said that you didn't do X, Y, and Z. And I explained to my supervisor, like, I actually did. And my supervisor was like, yeah, I didn't think you would not do that. And I was like, yeah, exactly. So I'm doing Foley care on this patient. Lying Leandra comes in. She said something like, oh, like, why didn't you do this? And her husband was like, oh, no, George did do that. Exactly, bitch. I did everything I'm supposed to be doing, okay? So she was gagged. She was like, oh, she didn't expect her husband to like stick up for me. So I'm like, yeah, exactly. So you basically went to my supervisor, lied about me, tried to get me in trouble instead of verifying with me if I did what I was supposed to be doing, which I did. And your husband gagged you, bitch. This is just a classic example of nurses eating their young because she claimed to be a nurse and she was like an older lady. So you could tell that she was just like trying to exert her power over me. I'm like, girl, like... Hey guys, it's Editing George here. So I'm editing this video and I'm gonna have to split this up into 2 parts. Because if I don't, it's gonna be a 45-minute video. It's gonna be too long and I just think it would be best if we did it into 2 parts. I'm gonna cut it here. Stay tuned for part 2 coming up, and we're gonna talk about more crazy patients, guys, because you wanted to be a nurse, you are a nurse, and this is the reality. So stay tuned. I'll see you on the next one. Bye.